The issues affecting you. Revealed, explained, discussed. Now on WGAL 8 In Focus.
Hello, I'm Susan Shapiro. There's an effort to call attention to mental health. The Centers for Disease Control and Prevention says more than 1 in 5 U.S. adults live with mental illness, and more than 1 in 5 teens ages 13 to 18 have, or at some point in their lives, have had a serious, debilitating mental illness. Tonight, we'll speak with a psychologist about the signs and symptoms of mental illness and what you can do about it. We'll also talk with a Susquehanna Valley man about his mental health journey and what he hopes you can learn from him. We're putting mental health in focus. Joining us now is Mike Diller, who's a psychologist with WellSpan. Thank you so much, Dr. Diller, for being here. We appreciate it.
Well, thank you, Susan, for having me. It's great to be here.
It's a good topic to talk about.
Oh, yes.
We talk about mental health. What do we mean by that?
So just like physical health, we want to have good mental health, good physical health. And so that's really, when we think about mental health, we're thinking about psychological, kind of cognitive, our thinking and our emotional well-being. Mental health is really the fuel for, and foundational fuel for whole person well-being. So mental health is just being able to make sure that we are in good places and spaces with our emotions and our feelings, and just kind of just how we're thinking, making sure we're thinking clearly and having kind of clarity of just kind of this is what I need to do today, having a positive mindset, positive outlook. So that's all kind of things that, you know, kind of fall into good mental health. We want good mental health just like we want good physical health.
Sure.
So that's a great way to start off, that, you know, very similar to physical health, we really want to have good mental health.
The numbers are pretty startling, though, how many Americans are suffering with a mental illness at any given time.
Right.
Has that increased, or is it just that we're diagnosing it more?
So it just depends on how you define, you know, mental illness, mental health, mental condition, adversity that's going to affect all of us at some point in time. No one gets a pass on adversity. So the numbers have, you know, when you look through the pandemic the last 4 years, the numbers have definitely increased in terms of significant elevations. You know, there were numbers that were going, you know, 3 times as high, 4 times as high in terms of anxiety and depression. As we look over the last 4 years, those numbers are still significantly at a high level. 1 in 5 Americans experiencing a mental health condition in any given year. But again, it's how do I define that? Because I think sometimes those numbers are probably a little bit lower. I mean, when we look in the mirror some days, I think all of us as human beings can say there are moments that I have struggled with my own mental health, my own mental and emotional well-being. So while those numbers are, you know, 1 in 5, that's significant. You know, we think 20% of people struggling, and of that 20%, only half ever get treatment. So that's another piece as well, and there are different reasons for that also. But the numbers can vary. I've heard 1 in 4, 1 in 5, but those are still significant even as we sit here today.
Still high. Now, all of us, as you mentioned, we might all feel, you know, sad,
Right.
down on a number of days. How do you know if you have something more serious?
Yeah, excellent question, because sometimes people think, well, yeah, I'm depressed or I'm sad. And those are normal feelings to have, just like happy and anger. You know, we want to make sure that we're hopeful and things like that. There's a full range of feelings. Sadness is a normal everyday emotion that we have, and we experience it, all of us. So when does it become more problematic? So I look at it this way. When you are kind of taking a look at yourself and you're just kind of assessing just how am I doing every day, and my daily functioning starts to be disrupted, some of the things that I need to do every day, my responsibilities, whether that's at home or school or in the workplace, they start to get disruptive and I'm not able to meet some of those things. That's when it starts to really get us into a place where we need to consider reaching out for additional support. So that, when I'm getting that, there's 3 kind of cardinal features. How intense are the symptoms I'm feeling and experiencing right now? How long are they lasting? And then how frequently are they happening? Again, very similar to physical health conditions. If I had something going on with my knee, I would ask the same thing. How intense is this situation here with my knee, the symptoms I'm feeling? How long have I been feeling it? How frequently? And then how much disruption is it causing in my life? The same thing with my own emotional well-being and my mental health.
You mentioned reach out. Who should you reach out to? What should you do?
So that could, you know, that's sometimes it's interesting because sometimes, like if Mike is really suffering and struggling and having a moment where it expands over several days, that's when it's a little bit more concerning. But for me, I may just be thinking, I'm fine, you know, I'm just going to keep driving and grinding, and so sometimes it's not even the person who's experiencing that really realizes that they're really struggling, it's someone else. So this is where everyone gets to play a role. this conversation today gives us opportunity to shine the light on, I may be struggling and these are some of the things I can do. So reaching out for help can range from many different things. If I see, Susan, if I saw you and we were friends and I saw that you weren't quite yourself, that would be an invitation for me to ask, you know, if I said, hey Susan, how are you doing? And you answered,
Oh, I'm fine.
wait a minute. And then if I say, hold on a second, are you really fine? If I sense something that might be off, that what you're telling me and what you're showing me are not connecting, that gives me a chance to say, Susan, I noticed something is a little bit off with you today. Last couple days, actually. Are you really okay? Are you doing all right? And then just sticking around long enough to be able to do that. So that doesn't even necessarily mean that I have to go see a counselor or a psychologist right off the bat. It could just be a trusted friend, a trusted colleague, a schoolmate or a friend in the community, being able to do that. So it can range from just a trusted kind of relationship and a friendship all the way to reaching out to maybe my family physician, or it could be, you know, a mental health provider in the community.
All right, well, stay with us because we're going to talk more about self-care and also treatment options.
Okay, wonderful.
This is WGAL 8 in Focus, coverage you can count on.
We continue our conversation with psychologist Mike Diller about mental health. We toss around that term self-care. I think of a massage or going to the spa, that kind of thing. But what do we mean by that?
Well, it could be going to the spa. It could be getting a massage. But self-care, I think nowadays through the pandemic, we've heard a lot about self-care. Sometimes we hear it quite a bit, and sometimes people don't. We kind of glaze over it, and we may not even truly define what that is. So you said, well, you know, massage or going to the spa. It can mean many different things, but self-care is really kind of the foundational kind of setup for everything else I want to do in my life. So if I want to be at my best self, if I did the hierarchy of needs through Maslow, which we're not going to do Psychology 101 today, I won't go through the pyramid, but if I did, the foundation of that pyramid, upon which everything else is based upon, is making sure I take care of my bare basics. Make sure I get my food, my nutritional fuel, sleep and rest, hydration. I've thrown in exercise and movement, even though Maslow didn't do that, but I threw that in there. The last 4 years, we've become much more sedentary.
I was going to say there's a lot of evidence that exercise can help with mental health, isn't there?
Yeah, absolutely. And exercise, Susan, actually can be it's been touted as the natural antidepressant. So I love that because it can be as simple as just taking a few extra steps. Instead of taking the escalator today, I'm going to walk up the stairs. But it can just be physical movement of any kind. Self-care is simply, how can I restore, decompress, recharge, reset for another time period? So at the end of the day, when I separate from whatever that is that I've been involved with through the day, if it's my work or if it's my school, it's creating boundaries and space to make sure that I can recharge, regroup, reset, decompress. That can mean many different things. So some people will say, I'm going to make sure I'm intentional and I always have a massage on the books. I'm going to go to the spa on this day. Sometimes it's just going out into nature for 3 minutes. 3 minutes in nature has been shown to actually improve and boost well-being. Sometimes it's doing something that really recharges me. For me, I love ice hockey. So at times I'm out doing ice hockey. That's my adult play therapy. So for someone else, I don't do ice hockey. So that's not going to be for me.
Find something that you do love.
Find something that resonates and connects with you. And that is something that can help restore, recharge, decompress, and reset for another day.
But what about treatment for folks who might be, have more serious conditions in terms of medication or talk therapy? What seems to be, the option?
Right. So I know that there are many different options out there. And so in terms of the counseling side of things, the talk therapy piece can absolutely be very, very helpful. So I think reaching out and making sure that that's an available resource and being able to connect people to resources within the community. We have some great organizations, even nationally with a National Alliance on Mental Illness, Mental Health America, but there's also local chapters that they have resources. Sometimes there's support groups that can be done. WellSpan Philhaven has that, our behavioral health entity. We've done things like to try, how can we meet people where they are in the community and where they are right now in a particular mental health issue. For example, we have a mobile crisis team over the last 2 years. A lot of times people, if they're feeling that they're in crisis, they end up going to the hospital emergency department. But now we actually have worked to help support our EDs and making sure people get what they need at the right time. Being able to even go out to the people at a school or a workplace or a home to provide support when they're feeling like they may have some type of emotional crisis situation.
At what point do you find that medication is needed?
Medication, as when I was in practice as a psychologist, that's not where I would often start, unless there was some severe, remember I talked about that continuum of level of functioning. If there was severe disruption in functioning, there may be a need early on to consider medication. That's usually not the go-to. We usually start off with some other types of intervention. Sometimes you don't even need the level of a psychologist in a more kind of psychotherapy or counseling kind of setting. Sometimes there's a growing body of literature and research out there about behavioral health coaching, which is a little bit less intense, less in terms of intensity of symptoms, where coaching in behavioral health kind of spaces can be helpful as
that's
well.
interesting.
So that's a whole nother kind of broadening kind of field where people can get some of this coaching. It's not therapy. If they need a higher level of care, then they can move into that therapy kind of relationship on the counseling side.
Take it step by step, I guess, right?
Medication can be absolutely effective, and that's where you would want to get, and connected with a physician who can prescribe a medication that matches the needs in terms of the symptom presentation that you may have.
Well, thank you so much. Appreciate that.
Absolutely.
Coming up on WGAL 8 in Focus, we'll talk with a retired Army Lieutenant Colonel about his mental health journey.
This is WGAL 8 in Focus, coverage you can count on.
Joining us now is Luis Mendoza. He's a retired Army Lieutenant Colonel and lives in Lancaster. Thanks for being here. And
thank you very much for
and your
having me.
willingness to share your mental health journey.
Absolutely, absolutely.
You've been diagnosed with PTSD. How did that come about?
I came about through my 32 years of service to the United States Army, along with several deployments to combat, and as well as I have several deployments here in the United States as well, helping with sending soldiers to Philadelphia with the riots, and then I went down to Washington, D.C. after the January 6th situation, as well as I was down at Katrina during helping with recovery.
And you've had a lot of personal trauma, too, including the loss of your wife and your grandmother.
That is correct.
Did that impact
absolutely.
your mental health as well?
Absolutely, because you don't know how to plan for or react whenever you have traumatic situations in your life personally or even in a professional situation. So, my situations definitely had some family members pass away. The most recent one was my late wife, who had a 10-year battle with breast cancer, and she passed away at the young age of 46 in 2018. I was left as a single dad. I had a child in high school and a child in middle school. At the same time, I was getting high in ranking, and I was trying to figure out manners and way and resources what I need to do to help out myself personally. One as a dad, number one, and take care of my kids and be a good role model for them, but at the same time, professionally as well, if I can continue on with my career.
What was going on? How did you know that maybe something was wrong?
Just your mannerisms, your behavior, what type of emotions you're not showing and demonstrating. Lucky enough, my leadership at the time gave me whatever time I needed in order to recover and take care of my family, which is number one, which is I'm very grateful for that opportunity at the time. And they asked me when I was going to be able to return back to work, and I said, unfortunately, I need another month to still please give me time to be able to recover, not only personally, but ready to go back to work and have that hunger to put the uniform back on, and because I had no desire to put the uniform back on.
Wow.
So,
and I imagine in the Army and in a leadership position, you're supposed to be, kind of gung-ho, right?
Absolutely. So, you got to get over that stigma. Some of the stigmas that we have, one, being male, being combat arms, myself also being Latino, you got to get over that stigma. Being in a leadership position, you want to be looked at as weak. At the same time, you have that fearful factor of making sure your superiors, your peers, and even more, if you get selected to be put into a leadership position, your subordinates look at you as a strong leader. And then they trust in you. Because number one, I believe one of the characteristics, attributes is trust. And lucky enough, I was able to manage and get over that, and I was selected to become a battalion commander, which I was in charge of over 500 people.
Oh, well, good for you. And now you're helping other veterans.
Yes. I retired just May of 2022 after a total of 32 years in the Army. And now I'm working for an organization helping fellow veterans with their VA disability claims and compensation.
And what do you tell them? What if somebody is experiencing what you did, maybe not in the military, but even, in the community?
First thing, you need to face the fact and identify that you go out and reach resources, ask. I have 3 circles in my life that I refer to. One is family. reach out to your family. And when I refer to family, it doesn't have to be blood related. It could be people that I grew up with. For example, there's friends of mine that I have a core group of friends, about 5 to 7, that have been friends since I was 10 years old. So they're not blood brothers, but they're my brothers.
They're like your brothers,
yes,
right?
Absolutely, Susan. And then also the second group is military. I have a lot of military family that have been through everything that I've gone through before my kids were born, or even after my kids were born too, and even to this day. So I still reach out to them, and regardless of rank. We're brothers and sisters in arms. And the third is soccer. For me, soccer is my outlet. I forget about things. I love it, watching it. I'm a very passionate individual, and that's who I am. So the sport is growing here, but outside in the rest of the world, football is number one.
Yeah.
So.
Do you think some of your friends and family members noticed that you were having some issues?
Absolutely, absolutely. They saw. I remember one incident after, unfortunately, my wife passed away. I couldn't sleep in our bedroom, but I was putting posts on social media 2, 3, 4 in the morning, and then a lot of people noticing. They're like, "What are you doing? Why aren't you resting? You need to get rest for yourself. You need to sleep." So then that's reaching out. At the same time, people exposed me to yoga, which helped me physically and as well as my mental state as well.
Yeah, I love yoga. Just did some
Yes.
this morning. Yeah. Well, stay here because we're going to bring back your friend who was already here, Dr. Diller, and we'll talk about what kind of treatments you underwent and are available.
All right.
This is WGAL 8 in Focus, coverage you can count on.
And we continue our discussion with Luis Mendoza, and we're back with Dr. Diller. Thank you again, both of you, for being here.
No, thank you.
What kind of treatment did you have, and how has it helped you?
I continue seeking treatment with a psychologist and as well as a trauma counselor. At the same time, I've conducted mindfulness classes, which has been very helpful in allowing me to understand myself, but also more importantly, be able to be a great role model for my 2 kids as well as my 2 stepchildren as well.
You mentioned, seeking out a friend or therapy. Somebody might be kind of hesitant to do that, having not done it before. What can they experience?
Yeah, I think it's important to normalize and kind of validate where someone is. So when we have some type of emotional distress, to not feel like, gosh, I should be able to get over this, or it's a sign of weakness. Reaching out is always, I believe this, and we're doing, I think, even better with this, a sign of strength and wisdom to be able to do that. So what can they expect? In terms of if you reach out to a psychologist or a counselor, you're going to get someone there that's going to try to do what they can to meet you where you are, to listen to the story, and then to help kind of be almost in some ways kind of a guide to help you kind of accomplish where you may wish to go, certain goals that you may have. This is where I'm at now, but this is not where I want to be. I want to get better in these ways. And then as a therapist or a psychologist, we're in a position that we can help kind of work with the person to help kind of navigate kind of where their story is now, to help them kind of write a future that's better than where it is now, left up to them to determine that kind of course as well.
Now, you mentioned you had a lot of people in your network and your circle, but a lot of people may not have that. We've heard so much about loneliness. Does that concern you?
Yeah, it is concerning. Dr. Vivek Murthy in 2023 put out, a significant paper and report on the epidemic proportions of loneliness now, and it has significant health impact and well-being impacts on people. So it is a concern, and any one of us can be, caught up into that. Even if I'm surrounded by a lot of people, I may be lonely in a room full of people. It's about that human connection piece, which we lost quite a bit of that during the pandemic, and we're still trying to come back from that sense of community and belonging and mattering and human connection. And so there are even small gestures that can make all the difference in the world. Lou, mentioned different things about 3 circles that really matter to him of social support. We need that as human beings. We're hardwired to kind of gravitate towards human connection. And so anytime we can do that, even in the smallest gestures, can make all the difference in the world. Kindness, care, empathy, compassion.
As he said, it might not be your family, just
Right.
maybe friends can help you out. How are you doing? And do you think this will be, kind of a lifelong thing for you, a struggle?
Absolutely. I continue seeking treatment now with a psychologist and as well as a trauma counselor. And it's helping me every day with my daily challenges and I don't want to say struggles, I like to say challenges to keep it more positive, and opportunities to continue growing and learning, but more importantly, being a great role model for my children and my 2 stepchildren. That's what makes me drive.
Yeah, it seems like you are. Now, have you noticed, changes in Lou and for the better? Since you're a good friend of his.
Well, what I have noticed is that someone like Lou, and he's discussed this already, even today, in terms of just in his role, just even being, male, Latino, in the military, always having just this kind of feeling that I need to be able to be strong and I need to be tough. And what I love about Lou is that he's very open even today. So I appreciate this conversation, that this vulnerability is strength, and he's living that. And so I think your story, I'm so grateful that you've told it, is, when I talk about reaching out for help, is a sign of strength and wisdom. I'm looking at him live that. And so yes, I do see helpful things that have, because he's been open to that. He's been receptive to that. He didn't kind of fall into, oh, I just need to keep going by myself. And I think if anyone takes a message from this today, it's that you don't have to walk alone. And this guy right here is telling a story that can help inspire people to say, you know what, I don't have to be alone.
Yeah, and he looks perfectly healthy. You never know what someone might be going through.
Nope, I love that, Susan. We all live a story, and you never know what may be going on in someone's story. So that's where that whole kindness and compassion, even if you don't know someone, my goodness, what a smile does to somebody else.
Right.
And actually for the person who gives the smile. It's a two-way street. He's got a great smile.
He does.
Yeah.
Well, thank you very much
thank
for
you very
sharing
much,
your
Susan.
story, and
Absolutely.
thank you for your expertise.
Oh my
We
gosh.
appreciate it.
Thank you, Susan.
The state offers mental health resources. You can call or text 988 to start a conversation. The state also has a support and referral helpline. That number is 855-284-2494. Thank you for joining us for WGAL 8 in Focus. For all of us at WGAL, I'm Susan Shapiro, and join us again next Saturday night at 7 o'clock for WGAL 8 in Focus, right after NBC Nightly News. And you can watch each episode of In Focus, plus WGAL's latest newscasts, original programming, and more. Just download the Very Local app and stream for free on Roku and Amazon Fire TV.